Every year, a new disease. I don't know if I should keep paying for insurance. Surviving these outbreaks is exhausting enough. I don't even know if I'm going to live to be 63 to get this salary.
我都不知道我能不能活到63岁领工资那天。
China is grappling with an unprecedented crisis, a perfect storm of converging threats. The Chikungunya virus is sweeping through the nation. COVID-19 continues to lurk in the background, and a chilling mystery is spreading. A sharp rise in sudden deaths among the younger generation, particularly those born in the 1980s. As Shanghai and other major cities wrestle with economic downturns, Chikungunya has spread from Guangdong to Beijing, plunging millions into panic. Meanwhile, reports of unexplained deaths among those aged 30 to 45 are raising questions about the transparency of the Chinese Communist Party, CCP. A grim picture is emerging of a nation facing a multifaceted crisis: health, economic, social, and political, with secrets obscured behind official statistics and propaganda. This is a breaking report, unveiling the truth about the unfolding disaster. Chikungunya, an uncontrollable viral storm, chikungunya fever, known in Chinese as Jigongyan literally chicken bone fever, has become China's latest nightmare. First reported in Guangdong on July 8, 2025, the virus has spread at an alarming rate. According to the Guangdong Center for Disease Control and Prevention, CDC, within a single week, confirmed cases in Foshan surged from 481 to over 4,017, with 90% concentrated in Shunda district. Cities like Guangzhou, Yangjiang, Zhanjiang, and even the capital, Beijing, have reported locally transmitted cases, sparking fears of a nationwide epidemic. Many suspect the true number of cases is far higher due to government suppression of information. Transmitted by mosquitoes similar to dengue fever, chikungunya's severity is terrifying. With no vaccine or specific treatment available, patients rely on fever-reducing drugs and immune support, which offer limited relief. Symptoms include high fevers of 39 to 40 degrees Celsius, excruciating joint pain described as life-questioning, red rashes, muscle aches, nausea, and headaches that feel like an explosion in the skull. Approximately 20% of patients develop chronic arthritis, causing debilitating pain for years or even permanent mobility loss. In severe cases, the virus can lead to paralysis or death, particularly among the elderly, young children, and pregnant women. Foshan, the epicenter of fear. Foshan, particularly Shunda district, is the epicenter of the chikungunya outbreak. With its dense population and rural areas conducive to mosquito breeding, Shunda accounts for over 3,600 of Foshan's 4,017 cases as of July 25, 2025. Authorities have designated 53 hospitals at level 2 or higher for isolation and treatment, increasing mosquito-proof beds from 3,696 to 7,220. Hospitals like Beijing Hospital are equipped with mosquito nets and screens, but the lack of specific treatments leaves patients enduring recurring fevers lasting 2 to 3 hours, leading to exhaustion. A Shunda patient shared on social media, "I've had a fever for 9 straight days, with joint pain so bad I can't walk. Fever reducers only help for a few hours before the pain returns. I'm healthy and exercise regularly, but this virus spares no one. Be careful, don't underestimate it." Such cries for help are flooding online platforms, amplifying public fear. Many are advising against travel to Foshan, especially to rural areas where mosquitoes thrive. Beijing shaken. The epidemic reaches the seat of power. The emergence of chikungunya in Beijing is a grave warning. The capital, a symbol of stability, is no longer immune to the epidemic's reach. Residents fear the government may reimpose strict control measures akin to those during COVID-19, heightening social tensions. A Beijing resident expressed, "We survived the COVID-19 lockdowns. Now, with chikungunya, will they lock down the city again? I just want my family to stay safe." The spread to Beijing is not just a health issue, but a political one. Many question whether the CCP is concealing the true scale of the outbreak to maintain an image of stability for the international community. Mosquito control and environmental sanitation campaigns have been launched, but residents view these as band-aid solutions for a crisis that has spiraled out of control. Sudden death surge. The 1980s, generation exhausted. Amid the chikungunya panic, a more sinister rumor is circulating: a 5.2% sudden death rate among those born in the 1980s, aged 35 to 45, meaning 1 in 20 from this generation has reportedly died. While state media dismisses this figure as a ridiculous error attributed to an AI called DeepSeek, the claim has tapped into deep public fears. The generation considered society's backbone is being squeezed dry by the CCP's system. Born between 1980 and 1989, this generation faces unique pressures. As only children under the one-child policy, they bear the burden of caring for 4 elderly parents and 2 children after marriage. In their youth, university education was free, but by the time they enrolled, tuition fees skyrocketed. Upon graduating, they entered a cutthroat job market with no guaranteed employment, unlike earlier generations. Soaring housing prices dashed their dreams of home ownership just as they began earning. The 9-6-9 work culture, 9 a.m. to 9 p.m., 6 days a week, or even 7-day work weeks, has left them physically and mentally drained, with chronic conditions like hypertension, diabetes, and strokes becoming common. Some suspect sudden deaths are linked to COVID-19 vaccine side effects. A Shenzhen construction worker shared, "Several healthy colleagues died suddenly after vaccination. They started getting persistent colds, then one day they didn't wake up." Reports from cemeteries and death registries in some regions show a significant decline in life expectancy, with one Shandong registry in 2024 recording an average lifespan of 65.8 years, including 5 out of 18 deaths, among those in their 40s. The CCP has cracked down on discussions of this issue, fining 9 individuals for stirring emotions and censoring social media, but the silence only fuels suspicions of a major health crisis. COVID-19, a lingering menace. While chikungunya spreads panic, COVID-19 remains China's greatest threat. According to the China CDC, SARS-CoV-2 infections still top the list of infectious diseases, with new variants emerging constantly. 5 years after the pandemic began, the virus is far from fully controlled, and many suspect the government is downplaying its severity. The combination of COVID-19, chikungunya, and sudden deaths is pushing China's healthcare system to the brink. A Guangzhou patient shared, "I survived COVID-19, but now I'm terrified of chikungunya. Neither has a cure, and I don't know how much more I can endure. The government says everything is under control, but hospitals are overflowing." Government response: cover-up or incompetence. Public frustration with the CCP's handling of the crisis is mounting. Many believe the government delayed releasing information about chikungunya, with the first case recorded on July 6th, but not announced until July 8th. In Foshan, mosquito control campaigns only began on July 19th to 20th, after the outbreak had spread widely. Senior official Wang Weizhong visited Shunda on July 25th to oversee containment efforts, calling for an all-out attack on the epidemic. However, many residents see this as too little, too late. The lack of transparency extends beyond chikungunya. Suspicions of suppressed information about COVID-19 and sudden deaths are eroding public trust. A social media user lamented, Every year brings a new disease, but we're never told the truth. They say we're safe, but hospitals are overwhelmed and young people are dropping dead. What are they hiding? Community response: unity or panic? Amid the crisis, Chinese citizens are showing both resilience and fear. A Foshan resident proudly shared, "I've prepared mosquito traps, repellents, and nets. Seeing all the dead mosquitoes makes me feel like I'm protecting my family and country." Stay strong, China. But not everyone is optimistic. A Guangzhou resident worried, "I got 13 mosquito bites despite using incense. I hear this virus causes lasting joint pain. I'm scared I won't be able to work." Social media is rife with conflicting opinions. Some downplay the crisis and urge against spreading rumors, but warnings from patients like, "This virus is worse than COVID-19, are fueling panic. A Shunda resident pleaded, "People mock those warning about the epidemic, but they don't understand our pain. Please respect and protect each other." A multifaceted crisis: economic, social, and political. Chikungunya is not just a health crisis. It exposes deep cracks in Chinese society. The economy, already weakened by COVID-19, is further strained as manufacturing hubs like Foshan face disruptions. Factories and businesses are halting operations due to labor shortages and containment measures. Workers struggle with rising living costs and job insecurity. Socially, dissatisfaction with the government is growing. One resident complained, "Every year, a new disease. I don't know if I should keep paying for insurance. Surviving these outbreaks is exhausting enough." Politically, suspicions of CCP cover-ups are undermining trust. Some sources, like New Tang Dynasty Television, cite Falun Gong founder Li Hongji, who claims these diseases are punishment for those tied to the CCP. While controversial, such views reflect deep societal unease. Advice for citizens: prevention and vigilance. To protect themselves, citizens must take strict anti-mosquito measures, use repellents, wear long clothing, install mosquito nets, and clear standing water. If symptoms like high fever, joint pain, or unusual fatigue appear, seek immediate medical attention for PCR testing. Self-isolation at home is prohibited. All patients must go to hospitals. Avoid travel to outbreak zones like Foshan, Shunda, or Guangzhou. Protect vulnerable groups like the elderly and children, who are at higher risk of severe outcomes. With COVID-19 still uncontrolled and sudden deaths rising, monitoring health and following medical guidelines are critical. China faces an all-encompassing crisis, with chikungunya, COVID-19, and mysterious sudden deaths intertwining to create a bleak outlook for a nation struggling to maintain stability. With the virus spreading rapidly, alarming death rates among the young, and government opacity, the Chinese people are confronting unprecedented challenges. Can the CCP weather this storm, or will hidden truths plunge the country deeper into crisis? The answer remains uncertain. Stay vigilant and informed. If you need more details or the latest updates, let me know.